This is One-on-One. We are pleased to be joined by Dr. Theresa Redling, who is Medical Director, Geriatric Health and Disease Management at St. Barnabas Medical Center in Livingston, and also connected to the Felician Institute of Gerontology. Good to see you, Doctor.
Thank you.
Fully disclose here, as we are doing this program, you have worked with our family, and as we do this program, I've treated my dad for a long period of time, and many, many others who have dealt with serious illness after the age of 65.
65.
Is that the official age?
Not really. I do sadly have some patients that are younger because they have a condition that usually older adults have, like Alzheimer's disease.
Yeah. People confuse between dementia, Alzheimer's. Connect that for us?
Sure. So it's kind of like saying I have cancer, and someone will say what type. This is the same thing. I have a dementia, or someone has dementia. You ask what type. So dementia is the umbrella term, and Alzheimer's is one type. Lewy body dementia, vascular dementia, frontotemporal dementia.
Right, right. So this field of gerontology, growing exponentially?
It should be.
What do you mean by that? I mean,
Well, there's a very small percentage of us that actually are trained to take care of older adults.
Because?
Maybe it's
I mean,
not,
the need's there.
Absolutely. In medicine, it's something less than 1% of people are fellowship-trained internists in geriatric medicine. So it's not a sexy field. It's not.
Why do you say that?
Well, I teach the medical students and medical residents, and it doesn't seem that it's something that they're drawn to. They may like a sexier field like plastic surgery or dermatology, and geriatrics doesn't seem to be a sexy field. Although when you really start doing geriatrics, it's really a wonderful thing. I mean, the amount of gratification that you get out of taking care of an older adult the right way. And you can't do it yourself. It takes a whole team.
Who's on the team? What kinds of people, kind of expertise?
Besides a physician, a geriatrician, social worker, nursing, advanced practice nurses, physical therapists, occupational therapists, pharmacists. It really takes a village to do it the right way.
What drew you, Doctor? I mean, I've had so many conversations with you, online, offline, with my family without, and
I saw when I was in medical school that if you make a small change in an older person's life, it could make a huge difference in the quality of their life. So, for example, someone that can't get to the toilet, so they may be incontinent, and they're completely dependent on a caregiver. If you can get them just to even transfer, to be able to move from a wheelchair to the toilet, I mean, how wonderful that is to improve the quality of life for someone. So small things make a huge impact.
But you know, let me just say this, and I would be less than honest to say that this wasn't a particularly difficult time to be doing this program. But there's a part of this that is not confusing, but I want to put on the table.
Okay.
Because you deal with people who are at the end, very often at the end of their life, and they often die in your care because of where they are in their illness. How do you deal with that with the family? 'Cause I know how you're dealing with us, but also how do you deal with it for yourself?
It's very difficult.
Because they don't often get better, but you try to improve the quality of their life.
So I also reinvented myself a few years back and became hospice and palliative care certified. And
Let me just say those people are exceptional.
It's difficult, absolutely. It's difficult, but it's so rewarding because you can help people live better, not just longer, with a better quality of life, really closely assess their needs, work with the family, respect their goals, and then help them transition when it's the right time to a more comfortable death. And that's a real gift, I think, to be able to give someone. It really
So
is
when
a
you're
gift.
up at the Institute for Gerontology up at Felician, to what degree do you talk about this as a gift?
Well, they really have a good grasp on what the workforce needs.
Not just clinical expertise.
No, and to put a geriatric curriculum into, even say, their Master's of Business program is really remarkable. It's a group of individuals, and some are physicians, and some are psychologists, and some are in the social fields, nursing, and we do talk about that. I mean, the importance of honoring the individual, honoring the elderly, and I think they do a great job, Felician, and it's really a pleasure to work with them.
Let me ask you this about our societal attitudes without being overly philosophical. To what degree do you think that we, as a society, don't even want to talk or deal with what it is we're talking about right now because of it?
Right. Nobody wants to talk about death.
And so therefore?
In fact, in this country, death is unacceptable.
Unacceptable.
Yeah.
As if we could
right,
stop it.
Right. It's a conversation when you develop a relationship with the patient, with the family, that should come naturally, ultimately.
But?
It takes a certain skill. It takes a skill of the physician. There's a requirement for not just the individual you're treating, but the family to kind of be on board. Where are we?
Yeah.
So it takes time. It takes a lot of time.
You love what you do.
Yeah, I actually do
Despite
love what
all the challenges.
So thank you for saying that. I do love
But you
what
do
I
love
do.
it.
I do actually love what I do.
I disclose the fact that I know a little bit about you, and it's rewarding in spite of
well, it's sad.
the tears and everything
it's sad.
else.
It's
But
definitely
rewarding.
sad. It's very rewarding, and I feel like it's part of my life's journey to educate others to do the same good work.
Well, let me just say this. On behalf of all of the families that are dealing with loved ones who are very sick, and again, this program will air at a certain time, and I don't know what the future is going to hold, so I feel a responsibility to say that right at this point because I know where things are as we are speaking. So thank you.
Thank you.
And speaking of extraordinary medical professionals, I'm about to talk about a medical professional who meant a lot, not just to our family, but to a lot of others. Check this transition out, if you will. A gentleman by the name of Dr. Leon Smith passed away a couple months back. He was in his mid-late 80s. He was the nation's top expert when it came to infectious disease. He wasn't just a great clinician. He wasn't just the go-to person when it came to so many difficult to diagnose infectious diseases. But in the mid-80s, when people were running away from the AIDS crisis, when doctors and some others didn't even want to go near AIDS patients, it was, in fact, Dr. Leon Smith who had the courage, the strength, the intuition, the humanity, and the heart to understand the necessity to treat patients in a certain way. And he insisted that those patients be treated the way they should be. And he led the way with his colleagues. And so it is why we here at Public Television acknowledge the work, the compassion, the caring, the fact that Dr. Leon Smith was a medical, clinical, humanitarian, a pioneer in so many ways. And so while he is lost to us on this earth, his work continues. Several of his children, in fact, are doctors, physicians, and they continue doing great work. So Leon, you joined us so many times on Public Television. You taught us so many times. So I just want to say thank you on behalf of everyone here at Public Television for being the medical pioneer and the humanitarian that you were for so long. Thanks, Dr. Smith.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Felician University, Bartley Healthcare, New Jersey Sharing Network, Johnson & Johnson, the Give Something Back Foundation, Adler Aphasia Center, and by the New Jersey Office of the Insurance Fraud Prosecutor. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.